hotline ng National Center for Mental Health sa gitna ng pandemic. 115 are suicide-related calls.
Mental Health Association, miabot na sa
mapaligon, doon na tayo sakto nga pasilidad, doon na tayo sakto nga professional nga
COVID-19 pandemic. Pag-usapan natin yan sa serbisyo ngayon.
Mental health is a topic that can be very personal and sensitive.
Ngayong pandemic lang po ako umabot sa point ng breakdown. Sa sobrang stress mo, sa sobrang overwhelming, and sobrang anxiety ko. Parang I wanted to let it all out.
As a student of Ateneo de Davao University, Alfred got some information about mental health, which bothered him since it is a common issue during the pandemic. He had gathered some information related to the issue. After he gathered the information, Alfred takes some notes on what to do about the issues, just like plans and insights on what he had learned about in the articles and files he got. This will also help throughout the documentary itself as we go expand through the mental health issue. Culture influences what defines healthy mental health. As cited in the study, it has an impact on how people express and display symptoms, deal with psychological disorders, and decide whether or not to seek help.
Talagang barriers na kinakaharap ang mga Pilipino when it comes to seeking help, professionally man yan or with friends or families. Bukod sa structural systemic problem, isa dyan siguro yung ating cultural trait.
Filipino culture has a wide range of beliefs, one of which being that mental health issues such as depression and anxiety do not exist, and that mental illnesses are something to be ashamed of.
Tandaan po natin, malaki po ang stigma pagdating sa suicide. Hindi po yan minsan underreported, minsan hindi na nare-report because of the stigma.
The active stigma about someone having a mental-related illness has been one of the reasons why there is suppression and hesitation to seek professional help. Studies have shown that Filipinos prefer informal support and only engage professional service providers as a last resort. Filipinos have significant difficulties obtaining care due to social and self-stigmatizing views on mental illness.
Wala siya in a sense na marami pa ring Pilipino ang hindi talaga informed kung ano yung mental health. It's alarming in a sense na it's affecting the people who needs mental health care. Kasi instead na humingi sila ng tulong, ang gagawin nila ay kikimkipin nila sa sarili nila yung problema nila until it's severe.
Kung merong victim blaming, meron din tayong blaming the patient, and this causes a lot of stigma. And we're just talking about the household, ha? Meron pa yan sa community. Lalong hindi magsasabi yung mga bata sa komunidad kasi nga, Filipinos have this strong culture of saving the face. Ito palang stigma na to nanggagaling mismo sa tahanan, sa komunidad.
And as a result of this stigma, the Philippine government and public sectors have paid very little attention to mental health. The lack of support and awareness about mental health feeds the stigma.
Ayon sa National Center for Mental Health, dumami ang mga tumatawag sa kanilang crisis hotline nang ipatupad ang nationwide quarantine, pagsasara ng mga kumpanya at negosyo at pagtaas ng bilang ng mga nagkakasakit ng COVID-19. Mula 400 kada buwan mula May 2019 hanggang February 2020, umakyat sa halos 900 tawag kada buwan ang natanggap nila para sa buwan ng March 2020 hanggang ngayong Agosto.
But when the pandemic started, parang naging extra siya. Parang there seems to be an extra number of individuals who just need someone to listen them, to hear them out. And then 7 to 8 months into the lockdown, parang the issues grow deeper. Mas heightened yung anxiety to the point that they already question if it's kung talagang sila yon.
Headlines about mental health cases have risen, especially in these times of the pandemic. It used to be one of the closeted issues in the Philippine society, but Filipinos learned that mental health matters as the country progresses. According to the study, the National Center for Mental Health or NCMH Crisis Hotline, established by the Department of Health last May of 2019, received 3,329 suicide-related calls in the first 6 months of 2021, compared to 1,282 in 2020. The hotline has an average of 32 to 37 daily callers from March to October 2020.
Most of the younger callers that we have are usually yung parents ang tumatawag, no, on their behalf, yung mga 15, 16, 17, most often than not, sila mismo yung tumatawag.
6 million Filipinos suffer from depression and anxiety, making mental illness the third most common condition. As a result, the country has the Western Pacific's third highest rate of mental disorders. The COVID-19 pandemic has contributed to increased mental health needs that are not sufficiently provided.
Ang nangyayari, like, we treat mental health like it could be just a common flu na parang, okay, hanggang ganito lang yung pwedeng i-provide na tulong. When in fact, mental health conditions are long-term conditions which would require long-term solutions and long-term assistance.
According to a 2020 study conducted by the Department of Health, at least 3.6 million Filipinos are affected by mental health concerns such as depression, substance use disorders such as alcohol use disorder, and mood disorders such as bipolar disorder during the pandemic. The Mental Health Act was signed into law in 2018 to protect each Filipino's mental health while ensuring accessibility, affordability, and high-quality service. The Act aims to incorporate psychiatric treatments and activities within the public health system to help Filipinos suffering from depression and mental diseases. The Act also helps Filipinos to have a deeper understanding of mental health. However, the implementation of this law was not as good as it was planned, as there was a lack of mental health specialists and assistants in this field. A lot of patients are still not catered to.
Bago pa man dumating po yung pandemic, problema na talaga ang issue ng mental health kasi po isa to sa mga programa na hindi masyado nabibigyan ng atensyon ng mga nakaraan.
Even though the country's first Mental Health Act and Universal Healthcare Law have been established, local Filipinos still lack mental health facilities, services, and specialists due to low government investment in health. The mental health sector accounts for only 5% of total healthcare spending.
This is the systemic failure of the implementation of our Mental Health Act. The problem is, do we have the budget for it? So again, we need funding to train, large-scale training of youth leaders, of school organization leaders, community workers, community health workers. We need a large-scale training for those groups of people so that they can provide support when the professionals are still swamped with other cases.
The Philippines currently has approximately 60 mental facilities, 700 psychiatrists, and 1,000 psychiatric nurses. Because most mental institutions are located in Metro Manila, most of them are based in the National Capital Region.
Marami po sa datos namin ang mayroong issue sa kanilang pag-iisip. Ang isang problema po dito ay yung kakulangan po ng tinatawag nating mga mental health practitioners. Konti po ang psychiatrist, konti po ang psychologist, and the likes, no? Kaya po talagang isang malaking hamon po ito, lalong-lalo po ngayong dumating yung pandemic.
Without ample support, plus the stigma attached to these mental health conditions, Filipino families may not give much importance to this matter. According to this article, the cost of therapy per session in Metro Manila ranges from 1,000 pesos to 4,500 pesos, depending on each patient's situation. Anxiety and depression treatments are costly. Branded medications typically cost around 130 pesos each tablet, while alternative antidepressants and antipsychotic meds can cost up to 300 pesos a piece. The need for the government to extend and use its power on this problem is a pivotal part of mitigating this issue.
No, but from a government point of view, ito isang panawagan din na sanay ang serbisyo at ang awareness din ng public health sector ay pagtuunan din ng pansin ang mental health.
Tama.
Sa mga estudyante naman doon sa mga eskwelahan, I think we have to encourage more people to go into psychology, to go into psychiatry, dahil kulang tayo ng mga psychiatrists.
And as a resilient institution, we drew our strength from the support of our colleagues in the department, our teachers, parents, and external partners. We get by because we have the help of the nation that values education. Still, we have a long way to go and deliver education to more than 26 million learners nationwide. And as we do all of this, let us not forget to take care of ourselves, prioritize our mental well-being in order to be of service more to others.
I like how the theme of the National Mental Health Week is phrased, mental health care. Ang ganda ng word na care, no? Kasi more than just we are taking care of ourselves para maging productive tayo. We want to, each other na mag-take care ng sarili nila because we care for each other. And that's a good a good reminder na even the videos that we showed earlier, yung maging kind tayo sa isa't isa, especially during this pandemic.
With the pandemic that is happening in the present, mental health issues have been common, especially with students. Therefore, programs related to mental health and symposiums are necessary to help the people cope up with related issues, which are helpful in order to assist the needy and promote awareness. Not only mental health symposiums and programs are needed for awareness, specifically in the public. Some examples are talking to your friends. Maybe they can help you. Also the public. These people learn a lot from you and have more chances of helping with these ways. They have more knowledge about the issues which can help to cope up. Lastly, being an advocate is not an easy task, but with that way you can speak for yourself and the people, give your opinions to the public and support them, especially the people with problems. This can be done on any platform, commonly on social media. Other ways are through a blog, creating a poster, and etc. This is not the end of the journey. Many things can happen in life. Therefore, the most important thing that we should do is to take care of our health overall. Be responsible, and when there's a solution, find a way.